What I'd like to show you is some ideas that we had about scenario rooms, which help veterans learn how to handle situations before they are actually out in that situation. So the first one we have is our pet shop. It's small. What they have to do first is to come in, and the veteran will have to get a shopping cart, and we have them turn around in here so that they have to actually shop on a shelf. What we're looking for is, this is a small area. The aisles of your pet shops are very small, and there will be a lot of people in this small area trying to ask the veteran questions. So we want to teach the dogs to ignore the things that are on the shelves. For the veteran to walk through, we have them pick up an item or two or three that makes noise in the cart, and once they do that, they walk out through in the training center around a lot of other people to simulate being in the store, and then come back in and check out. As they're checking out, then people will be behind them that will start asking them all the questions that the public is going to ask them. So this is the first one we start with. It does make the veteran very uncomfortable being in a short, small area, but we want to make sure that the veteran doesn't have any anxiety attacks and how to handle that as well. The first thing that the person at the counter will do is shake the bag. And we want to make sure that the dog doesn't become scared, bolt, pull the veteran in any way. So we shake the bag out first, we put the items in the bag, and then we shake the bag, and they walk with the bag with the items in the bag. So little things like this are crucial, because you never know what's going to catch a dog by surprise, and we don't want them to pull down a disabled veteran. This is our cafe. It's small. We use this scenario to teach the dogs where to be when they go out to eat. Dogs should always be under the table, not seen, not heard. We stress that they want to get a low top table, but we do make them learn to sit at a high top table just in case there's no other option. We are really against them using the high top tables because it's more difficult to be close to their dog. The dog will be down lower, they won't have as much control sometimes, and it's not as comfortable. If the veteran has an anxiety attack or a flashback, something happens, the dog needs to be able to get to them immediately. What we're looking for is the dog's willingness to go right under a table. I don't want a veteran to be fighting to try to pull a dog under a table out in public. So we have them in their daily training lessons at home. When they sit down to eat, they teach the dog under command, and that means to go under the table wherever they're eating. We have a waitress that comes in that offers them things, offers them food, and then accidentally spills something on the floor. And we teach the dogs that no matter what's dropped on the floor, to ignore it. The other reason we use this is for the restaurants are very big in saying, this is a restaurant, it's a health code, you can't come in here with your dog. So we teach them how to answer those questions and have well-behaved dogs that most people don't even know are in a restaurant until they get up to leave. This is the waiting room. Doctor's office, VA waiting room. Chairs are together, sometimes very tight. We've picked different flooring in each area so that the dog has to learn to walk on any type of flooring that's around them. But we pick different colors as well. Sometimes the white flooring will set them off. A shiny flooring will make the dog not want to walk on it, and that's why we use different floorings. In here, we'll have veterans sit in here with their dog, teach them where to place their dog if they have the option. We will sometimes have our staff sitting in every chair, and then we make them, the veteran, figure out what to do, how to place their dog and where to go. We'll have several dogs in here in each row sometimes. When the chairs are small, it's very difficult for a veteran to put their dog under these type of chairs. So we do teach them to sit in the chair and have their dog behind their legs, so that the dog is not out in the public where somebody can grab it, kick it, pull the dog, or try to call the dog. So the dogs would be brought over to do a down on the side right here against the wall, as they would in any doctor's office, so that the doctor is free to move around the table. One of the things that I would like to explain is this veteran put down a mat. we do encourage them to teach their dogs to be trained to a blanket of some sort, so that when they go out in public, that they're not leaving dog hair on somebody's carpet or dog hair on their floor. That's their safe place. So they know when they're put in that, then she can go ahead and sit where she needs to sit, and the dog is where it needs to be. Okay. See, the dog is intent watching her, but not to the point where he knows he needs to move yet. What we want to watch out for is anger issues with a veteran. It's a crowded room, they don't know where to sit. They get very nervous, very upset. They may walk away, they may leave their appointment. So our goal here is not to make the scenario too hard to start with, but to give them the ability to know where to put their dog, how to place their dog, and do it comfortably, and then the scenarios get a little harder as they go along.